A critical lifeline for survivors of domestic violence and abuse in Austin is now at risk. Safe Alliance leaders say funding shortfalls could force multiple programs to shut down. KVUE's Brianna Perez explains what's at stake and what could happen if funding doesn't come through.
For some sexual assault survivors, these doors open the way to safety.
This is one of the actual exam rooms. We are able to offer choice. We're able to offer comfort and safety, which is something that they don't get in hospitals a lot of times.
Holly Bowles, director of sexual assault victim advocacy at Safe Alliance, says Eloise House has been around for 10 years, aiming to create a better experience for survivors at no cost.
What we were hearing from people is that they were going to the hospital, they were having to tell a ton of people what happened to them. They were having to wait hours and hours for a private room to be available. And then after the exam was done, they were getting a bill for thousands of dollars.
An experience Samantha says she experienced firsthand.
I remember sitting in that hospital waiting room and thinking I should just walk out. There's no point, it's so busy. It was a process that was not necessarily designed for survivors of sexual violence specifically.
Officials say the program handles about 95% of all forensic exams in Austin, roughly 600 each year. But now it's one of 4 Safe Alliance programs facing possible closure because of funding challenges.
In the last year alone, we've lost about $4 million, right, from both philanthropic sources and government sources. And when I say government, I don't mean just the city. I mean city, state, federal funds.
CEO Pierre Barastain says with voters turning down Proposition Q last November and changing federal priorities, funding hasn't kept pace with growing demand for services. Adding these cuts simply shift the cost elsewhere.
The reality is that not having money to run these services is just going to mean that other hospital systems, emergency rooms, the police department, courts, right, homeless shelters, they're going to have to absorb the shock of the lapse of these services.
He says they're now turning to the city, hospitals, and community partners for help as several programs approach a critical deadline.
The work that we do is quiet. The work that we do is behind the scenes, but it has a tremendous impact in the public.
Without new funding, Eloise House could close and move forensic exams back to hospitals on May 31st. Other programs, including SAFE's domestic violence shelter and supervised visitation services, could also be cut by the end of the year.